Hi, my name is Bruno Alexandre Krinsky, and I made this work in collaboration with Daniel Ruiz, and our advisor is the Professor Eduardo Todd. Our paper is called Spark in the Dark, Evaluating Encoder-Decoder Pairs for COVID-19 CT Semantic Segmentation. This presentation is divided into introduction, methodology, experiments and results, and conclusion and future works. In this article, we approach the COVID-19 computer tomography semantic segmentation problem. This problem consists in performing the per-pixel classification of COVID-19 lesions into the slices of computer tomographies of patients infected with COVID-19. The objective of our work was to perform an extensive benchmark of segmentation networks and datasets in this problem. Most of the works proposed in this problem based their networks in units and were limited to one or two datasets. So we noted the necessity of performing a comparison of other segmentation models and evaluating them in more datasets. To achieve our goal, we used the encoder-decoder structure, where the encoder is a standard convolutional network, and the decoder is the segmentation model. We evaluated 20 encoder models. Between them, the most used in the field are HisNets and DenseNets. And we evaluated 6 decoder models, with the units being the models most applied to the problem. We evaluated the segmentation models in 5 datasets: COVID China, MedSeg, MosMed, Record, and Zenodo. The first dataset is the smallest one, with 750 images, and containing 4 classes: background, long field, ground glass opacity, and consolidation. The second dataset, called MedSeg, is also a small dataset with just 929 images and containing 4 classes: background, ground glass opacity, consolidation, and pleural effusion. This dataset presents some issues like coarse segmentation masks and trash markings like circles and arrows, pointing to the lesion regions. However, as the first dataset proposed, it is one of the most used in the studies of COVID-19 segmentation. The third dataset, called MosMed, has 2049 images and has 2 classes: background and ground glass opacity consolidation. This dataset is very imbalanced, with the lesion regions representing less than 1% of the pixel in the images. The fourth dataset, called Record 1A, is the largest dataset with 9,166 images and has 2 classes: background and infections. The last dataset, called Zenodo, is an evolution of the MedSeg. It contains 3,520 images and has 4 classes: background, left lung, right lung, and infections. Also, this dataset does not present the problems of the MedSeg. In order to evaluate the models, we combined the 20 encoders with the 6 decoders, resulting in 120 models evaluated. We split the datasets into 8% for training and 20% for tests. We used a 5-fold cross-validation strategy to train our models in each dataset, resulting in 3,000 experiments. We use transfer learning, with the weights of networks being initialized with the emergent weights, and we didn't apply any data augmentation. The images was resized to 256 for 256 to fit the network's input, and we trained the models for 50 epochs and used the learning rate of 0.001, with the learning rate being divided to 10 every 10 epochs. In order to evaluate the models, we use the F-score and intersection of union metrics, and use the 1 minus the average of these two metrics as the loss to train the networks. Here we have the training and validation curves for the first dataset. Each line is the average F-score curve of all encoders combined with the decoder. In this first dataset, with exception of the PSPNet and the FPN, all decoders achieved close results. Also, with exception of this dataset, all networks achieve close training validation curves, showing a great generalization capacity. In this second dataset, the networks achieve very low results when compared with other datasets. This happened due to the coarse segmentation masks and trash markings present in the images. In this third dataset, the highlights goes to the FPN network, which wasn't capable of learning the lesion class. In general, all datasets are extremely unbalanced, with the lesion class representing a small portion of the images. And this dataset presented the worst class imbalancing, with the lesion pixel representing less than 1% of the image. Due to this problem, the FPN network wasn't capable of learning the lesion class. In the fourth dataset, with exception of the FPN, all models achieve very good results. This dataset is the largest dataset in number of images, which help the network's learning process. The network also achieved good results in the last dataset, with exception of the FPN and the PSPNet. We also performed an evaluation of all encoder-decoder combinations in the test set. However, in general, all networks achieved similar results with the validation, so due to spacing in the presentation, I will present just the results of UNet++, which outperformed the other decodes. The test results for all other decoders are presented in the paper. The blue color results are the best F-score achieved, and the red color are the best interception over union results. Here it's possible to visualize the difference between the encoders, and in general they achieve very close results, which means the depth of the encoder does make much difference, since small encoders achieve similar results with the deepest encoders. Here we present a table with the number of parameters of each encoder in millions of parameters. As presented before, small networks like RegNets achieve close results with the deepest encoders. This is an important result since small network uses a small amount of memory to execute and use less time in the training step. As conclusion of our work, there is no definitive answer which encoder-decoder combination is the best. However, our study provides a guideline for selection of encoder and decoders depending on the scenario in which these networks will be applied. Also, the UNet and UNet++ outperformed the other decoders. However, the LinkNet and MANET also achieve impressive results. Meanwhile, the FPN and the PSPNet show not to be good choice for this problem. For future works, we intend to investigate data augmentation and other balancing techniques, since it showed to be the most critical problem presented in our experiments. The code used for this work is available in our GitHub. Thanks for your attention.